Hello, welcome to Merced County Public Health's Dental Health Workshop. Today we'll be covering some common mistakes we make in our dental health routines. We'll go over brushing, flossing, eating right, how to brush with braces, and making your dental appointments. The learning objective for today is by the end of this presentation, you will be able to state three things that you can do to improve your dental health and your dental health routine. So, good oral hygiene is a simple daily habit that plays a big role in your overall health. Brushing, flossing, and regular dental checkups help prevent cavities, gum disease, and other dental issues. Staying consistent with these basic routines can help your smile, boost your confidence, and support long term well being. What is oral or dental health? Oral hygiene is the practice of keeping your mouth clean and disease free. It involves brushing and flossing your teeth as well as visiting your dentist regularly for dental x rays, exams, and cleanings. Some signs of having poor dental health are as having cavities, bad breath, tooth decay, plaque, receding gums, toothaches, and much more. So, how do you start a dental routine? Start with brushing the correct way. Some common brushing mistakes are one, using a brush, the wrong brush. Some toothbrushes are too big or too hard. If you brush too rough, it can hurt your gums. A soft toothbrush is usually best to clean your teeth well without hurting your mouth. Brushing too hard, pressing down really hard, does not make your teeth any cleaner. It can actually scrape your gums and wear down your teeth. Gentle brushing works best. Rushing, not brushing for long enough. Many people brush for only a few seconds, but teeth need about 2 minutes to get clean. That's about the time it takes to sing Happy Birthday or some other song in your head. Not replacing your toothbrush. Old toothbrushes don't clean well. When the bristles get bent or fuzzy, it's time for a new one. Most people need a new brush about every 3 months. Not knowing the right motion. Scrubbing back and forth really fast doesn't reach all the spots that you need to get clean. Small circles help you clean better. Move slowly and make sure you brush every side of your tooth. Forgetting the gum line is where your teeth and the gums meet. Germs like to hide up in there. If you skip this area, plaque can build up. Brushing gently avoids plaque buildup along your gum line and keeps you healthy. Brushing. Brushing your teeth for 2 minutes at least twice a day can do a lot, although you have to make sure you're brushing the correct way. Position your brush about at a 45-degree angle. Do not brush too hard. This could cause more harm than good. Remember to brush all the sides of your tooth. Tip 1. Angle your toothbrush the right way. Hold your toothbrush at that 45-degree angle. This means you should tilt your toothbrush, not point it straight up and down. Tilting helps the bristles reach the spots along your gums where plaque likes to hide. Point the bristles towards your gums to brush away from them. Think of it like sweeping the dirt and grit off your porch. You want to gently sweep the plaque away from your gums so it doesn't build up. Watch out for plaque. Plaque is that sticky film of germs that sticks to your teeth. If you don't brush it away, it can cause cavities and make your gums sore. Using the right angle helps you clean it off before it can cause trouble. Tip 2. Don't brush too hard. Brushing your teeth harder does not make them cleaner. When you brush too hard, you can actually hurt your gums and scrape the outside of your teeth. This can make your gums sore and even cause them to bleed. Gentle brushing works the best. Think of it like petting a small animal, soft and careful. Let the toothbrush do all the work. The bristles are designed to clean your teeth without needing to press down. Brushing gently keeps your teeth healthy and your gums happy. Different types of toothbrushes. So, soft bristles are recommended by dentists. Soft bristles are gentle on your gums and the outside of your teeth. They clean well without hurting your mouth. Most dentists say soft brushes are the best, especially for people with sensitive teeth and gums. Medium bristles. Medium bristles are a little stronger than the soft ones. They give a mix of gentle but firm brushing. Some people like them, but they can still be too rough for sensitive gums. Hard or firm bristles. These bristles are the strongest. They're stiff and can scrub more. They also hurt your gums if you're not careful. They're usually only for people with strong teeth and gums who need extra scrubbing. Electric toothbrushes. An electric toothbrush uses the battery to make the bristles move on their own. You can just guide it around your mouth. It helps you clean your teeth really well because it moves faster than your hand can. When do you change your toothbrush? It is important to change your toothbrush every 3 to 4 months. After a while, the bristles start to bend, flatten, or get worn out. When this happens, the brush can't clean your teeth very well. The worn out toothbrush also can hold germs. Changing it regularly helps keep your mouth cleaner and healthier. A good rule: if your toothbrush looks old and the bristles look fuzzy, it's time for a new one. Toothpastes. Toothpaste is important because it helps your mouth stay clean and healthy. When you brush with toothpaste, it helps remove plaque, which is that sticky film that can cause cavities. The toothpaste also helps freshen your breath, so your mouth smells nice. Most toothbrushes have toothpaste have fluoride, which is that special ingredient that helps the outside of your teeth, called enamel, stay stronger. Strong enamel helps protect your teeth from getting holes or becoming weak. Using toothpaste every day, every time you brush, can help you clean your teeth, and your teeth will stay strong and healthy. So, some ingredients to look for in your toothpaste: fluoride. Choose a toothpaste that has fluoride. Fluoride is super important because it helps fight cavities and keeps your teeth strong. It protects the outside layer of your teeth so it doesn't get weak or damaged. Check the label when you pick a toothpaste. Look at the label on the tube or the box. It will help tell you if it has fluoride and other helpful ingredients. Reading the label helps you choose a toothpaste that keeps your mouth healthy. So this is just a before and after. Let's take a look at what proper brushing can do. Notice the before picture, the yellowing, the gums starting to recede. In the other picture, the teeth look whiter and the gums look healthy. Brush your tongue. Your tongue holds a lot of bacteria, up to 90% of the germs in your mouth, actually. This is because the tongue is not smooth. It has tiny bumps and little cracks where bacteria can hide. If you don't brush your tongue, the germs stay trapped. When they sit there too long, they can cause bad breath. This is why brushing your tongue is super important. Brush Gently brush it every time you brush your teeth so you can clean away that bacteria and keep your mouth fresh. Best practices when you're brushing your tongue. 1. Stick your tongue out as far as you can. This helps you reach more of your tongue and it can get it clean, get it better clean. Start brushing at the back and gently place your toothbrush near the back of your tongue and move it forward. This pushes the germs out instead of spreading them around. Use gentle brushing. You don't need to scrub too hard. Soft brushing works best and keeps your tongue from feeling sore. Brush your whole tongue. Your tongue has bumps and tiny cracks where bacteria hide. Brush the middle, the sides, the tip to clean everything. Rinse your mouth afterwards. After brushing your tongue, rinse with water and wash away the germs that you have loosened. Now let's talk about flossing. Flossing. Choose which floss best works for you. There are different kinds of floss, and you can pick the one that works best for your teeth. Some floss is waxed, which helps slide between tight teeth. Some is unwaxed, which feels a little rougher. Some some people also like to use a floss pick, which is easier to hold if regular floss is tricky for you. Get a long piece of floss. It's important to use a long piece of floss so you can wrap it around your fingers without hurting them. If the floss is too short, it can squeeze your fingers too tightly and cut off the circulation. A long piece gives you a better grip and more clean sections to use. Hold the floss properly. Wrap the floss around your middle finger of one hand and the rest around the middle finger of your other hand. Then use your thumb and index finger to pinch the floss and guide it. You should have about 1 to 2 inches of floss between your hands to work with. Use the C shape technique. Gently slide the floss between your teeth and curve it in a C shape around each tooth. Move the floss up and down to clean under the gum line where all your germs are hiding. This make sure to use a clean section of floss for every tooth so you don't spread bacteria around. When should you floss? Dentists say it's best to floss before you brush your teeth. When you floss first, you remove the food and plaque from between your teeth. Then, when you brush afterwards, the toothpaste can clean those spaces even better. Studies have shown that flossing first removes more plaque than flossing after brushing. But the most important thing is you should be flossing at least one time every day. It doesn't matter if it's in the morning or night. Just make sure you do it daily to keep your teeth and gums healthy. So notice the difference between the inflamed gums and the healthy gums. See the receding? It's really noticeable in those bottom gums. Let's talk about braces. So when you or your kids get braces, brushing and flossing can feel a lot harder. The brackets and wires make it tricky to reach every spot, so you have to work extra carefully to keep your teeth clean. Dentists recommend spending more time brushing to make sure you remove all the plaque on your teeth. The plaque, again, is the sticky film of germs, and braces give it even more places to hide. For the most important part of your routine is the flossing. Because braces and wires have tiny spaces, bacteria can get stuck really easily. Flossing helps keeps clean between your teeth and around your braces so your gums stay healthy and your smile stays bright. Taking good care of your teeth while you have your braces helps make sure your smile looks amazing when your braces finally come off. So, how to floss with braces? Flossing with braces can feel tricky, but there are special tools that are made can make it much easier. These tools help you clean around the wires and the brackets so you can keep your teeth and gums healthy. Interdental brushes. These are tiny brushes that fit between your teeth and around your braces. They can help clean spots regular floss can't reach. You just have to use them very carefully because pushing too hard can poke your gums. A floss threader. A floss threader looks like a tiny plastic needle. You use it to help slide the floss under the wire of your braces. Once the floss is under the wire, you can floss your teeth like normal. It's super helpful when getting into tight spaces. A water flosser. A water flosser sprays a small stream of water to clean between your teeth and around your braces. It is gentle and easy to use and helps wash away food and plaque. Using these tools makes flossing with braces much easier and helps keep your smile healthy and happy while your teeth are moving into place. Eating right. This is extremely important. When you eat, what you eat has a big effect on your teeth because everything you chew goes into your mouth first. If you eat a lot of sugary snacks or junk food, the bacteria in your mouth gets excited. Why? Because sugar is their favorite food. When these bacteria eat sugar, they make acid. That acid can slowly wear away the strong outer layer of your teeth, your enamel. This can cause cavities. Eating healthy foods helps keep your teeth strong and protects your smile. Sugary drinks are bad. Drinks like sodas, sports drinks, and milkshakes have a lot of sugar. When you drink them, the sugar sticks to your teeth and feeds the bacteria. These bacteria make the acid that breaks down the protective layer of your teeth. That's why sugary drinks are tough on your smile and have high carbohydrate foods, and so are high carbohydrate foods. Foods high in carbs like chips, crackers, white bread also break down into sugar in your mouth, even though they don't taste sweet. They feed the bacteria that cause cavities. Fiber and crunchy foods are good. Crunchy foods with fiber help your mouth make more saliva, which washes away the bacteria. They also help scrub your teeth naturally while you chew. So, is found in foods like apples, carrots, celery, nuts, whole grains, and foods with vitamin D are all good. Vitamin D helps your body absorb calcium, which helps your teeth stay strong and are less likely to become weak or brittle. So, calcium and vitamin D are found in fatty fish, egg yolks, fortified dairy products, and even sunlight helps your body make vitamin D. So, some add ons. These are just extra tools that help your smile stay super healthy. You don't have to use them, but they can give you better cleaning and help you reach places your toothbrush might miss. Mouthwash. Mouthwash helps kill bacteria in your mouth. It also makes your breath smell fresh and reach spots that brushing and flossing might not get to. A tongue scraper. A tongue scraper helps remove the bacteria and tiny bits of food from your tongue. This can really help with bad breath and keep your mouth cleaner. An electric toothbrush. An electric toothbrush moves on its own and can clean your teeth really well. Many have timers to make sure you brush long enough. And moving the bristles can reach those tricky spots. A water flosser. A water flosser uses a small stream of water to clean between your teeth and along your gums. It's great for people with braces or sensitive gums because it's gentle and easy to use. So, find a dentist. Finding a dentist is important because you need someone you can trust and visit regularly. Start by looking for a dentist in your local area and think about what you need. Some dentists offer special services, so choose one that fits you best. You can also ask your family and friends or neighbors if they have a dentist that they like. Recommendations can help you find someone who is kind and does a great job. Another smart step is to call your insurance company. They can tell you which dentists are covered by your plan or which ones cost the least for your visit. You can also look online for reviews. Reviews can tell you what other people think about the dentist, like if the office staff is friendly, if it's clean, or if everyone is helpful. Finding the right dentist helps you take good care of your teeth and helps you with your healthy, happy smile. So before you go to your dentist, prepare your information. It's a good idea to have all your information ready before you make your dentist appointment. This helps everything run smoothly and keeps you from feeling stressed at the last minute when you're in the office. If you've been to that dentist before, you won't need as much information. But if it's your first time, they'll ask for more details. The basic information you'll need are things like your name, your phone number, and the reason for your visit, like cleaning or tooth pain. Insurance details. Have your insurance card ready. The office will use it to see if your plan covers what your plan covers and how much you might need to pay. Dental records. If you've been to another dentist before, you may need your old dental records. This These help your new dentist understand your teeth and your past treatments. Ask questions. It's okay to ask questions before your appointment. You can ask things like, do you have a Spanish speaker on staff? Is there parking? Do you offer payment plans? Asking questions helps you feel prepared and comfortable. Setting up your appointment. There are two main ways to make a dentist appointment, either online or over the phone. Choose the one that works best for you. Think about how much time you have because sometimes making an appointment can take a little while. Some dental services might not let you eat a certain amount of time afterward. So it's important to plan ahead. Make sure you won't be hungry or busy right after your visit. It's also a good idea to set reminders so you don't forget your appointment. Before you go, ask the office if you need to bring any documents like your insurance card or dental records. On the day of your appointment, try to arrive at least 10 minutes early. And don't forget to brush your teeth before you go so your dentist can check your teeth easily. Dentist checkups. Dentists recommend getting checkups every 6 months. This helps your dentist keep an eye on your teeth and catch any problems early. Some people may need to go more or less often, depending on what their dentist thinks is best for them. It's important to know that your checkups are not the same as treatments. A checkup is when the dentist looks at your teeth, cleans them, makes sure everything is healthy. Treatments like fillings or braces only happen if the dentist finds a problem. Regular checkups help keep your smile strong and healthy before anything serious happens. So, just to recap, the three most importance for maintaining a healthy smile and strong oral hygiene are brushing, flossing, and eating a balanced diet. Brushing removes plaque and bacteria, flossing cleans between the teeth where the toothbrush can't reach, and eating right helps protect your teeth, keep your teeth from decay, and strengthens your enamel. So, did you know Medi-Cal now offers dental coverage? To find out To find a dentist, if you have Medi-Cal, go to smilecalifornia.org. Thank you for coming today, and we hope you visit some of our other healthy living courses on this website. Have a great day.